Of course, a new school year is underway, which means sport and other after-school activities are soon to follow. A sports physical can help promote healthy experiences, habits, and ensure that your child is able to safely participate.
Pediatric cardiologist with UT Physicians, Dr. Adrienne Walton, is joining us now with more on why getting a sports physical is such a critical thing. Dr. Walton, welcome to the show.
Thank you, guys. Thank you for the invitation.
We should mention, by the way, UT Physicians has more than 1,500 healthcare providers, and there's so many different specialties that no matter what the issue you're dealing with is, that's a great place to begin.
Absolutely. We're ready to address any issue, any medical concern, preventive health, which is most important, that any patient, any age.
And an athlete's physical, I mean, that is a preventive thing that some people might not think about, and it's critical because it can uncover some pretty scary issues, right?
Absolutely, absolutely. You know, scientists, CDC says that after 5 years of age, the drop-off in terms of any person, whether it's a pediatric patient or adult patient, the drop-off for preventive care significantly declines. So sometimes these pre-participation sports examinations gives us an opportunity to be able to see patients, to look for risk factors, to make diagnoses that would otherwise go unnoticed.
And what's really interesting when we talk about these sports, basically physicals for our kids, what are we looking at here? What should we as parents be making sure that's being covered throughout this physical?
Sure. So the physical, the sports examination is certainly a physical. We look at the medical history, and that's the medical history of the patient, as well as family history that can be concerning. We look for signs and symptoms of any concerns that would be relative to an athlete's performance, which would include taking a look at all systems, from dermatologic, certainly to cardiac, maybe being a cardiologist, all the way down to muscular changes, and hopefully to prevent injury.
And Dr. Walton, as you just mentioned, a lot of times maybe some of these kids that are getting these sports physicals, there's underlying issues that maybe would never be detected.
Absolutely.
And the cardiology is one of those. So what are the questions or maybe signs to look for?
So signs that a family or a patient or the athlete or even the coaches that may look for are, from a cardiac standpoint, are exertional. So shortness of breath with exercise, overwhelming, shortness of breath or chest pain that would be out of proportion to their level of exertion or being compared to their peers. Other things would be fainting, for example, exertional fainting, or the heart rate perception is perceived to be higher than what would typically be normal.
And thankfully those issues are rare, but I mean, and we don't want to scare anyone today, but we always hear about these cases where a seemingly healthy young person drops dead on the field because maybe there's a congenital issue they were not aware of.
Sure. Those incidences are certainly rare.
Right.
But whenever they happen, they affect the entire community. So that's why it's certainly important to just be checked out every year. See your internist, see your family physician, see your pediatrician, so that these things, when there are risks that are present, can be founded.
And what's interesting is some of these questions and tests that you're talking about, really no screening or labs or anything, just that beginning of the conversation can be helpful for you.
Just the conversation. Past medical history. Have you ever felt short of breath? Have you ever had chest pain with exercise? Family history of persons under 50 years of age with heart attacks or stroke or sudden death that was thought to be related to a cardiac issue, for example. All gives us opportunity to have the conversations with the parents as well as with the patient to pull out those things that may just be concerning.
You know what's really interesting when you talk about shortness of breath? I mean, kids can have that as well. That's not something that just adults have.
Absolutely. So the child who says, this year at 10 years of age, I want to try out for the track team, and they've never participated before. So certainly there can be endurance, and those are the common things, okay, that can happen. But these physical exams help to separate what's common from the rare events that can sometimes be harmful.
And you mentioned the drop-off rate. Essentially, that just means people are not going to the doctor, right?
Well, I mean, take for yourselves. You mentioned that you had children. You know, when you first have a baby, that baby goes in at 2 days old, at 2 weeks old, et cetera, et cetera. So they accumulate at least 12 visits, even the first year of life. And every year after that, you get a little more comfortable. Immunizations are typically done around age 5. And then you have to be reminded to check in, So that's where we get the drop-off. And that's what we are here today to hopefully tell parents that even when things appear to be normal, again, it's not necessarily so. So follow up for pediatrician as well as for adults to get checked every year.
Sorry to jump in, but there is a $19 sports physical that you guys are offering. There's the information right there on your screen. You can call 888-4UT-DOCS or log on to utphysicians.com/sports. And if you'd like to schedule an appointment with Dr. Walton or one of her cardiology associates, you can call 713-486-6755. Dr. Walton, I know everyone is very busy, but this is so important, so thank you for stopping by.
Thank you, guys. Thank you.
And still ahead, we've got a lot of the latest trends for your hair and for your skin.